Our next guest has treated over 2 lakh children across India and Australia, published more than 160 research papers, written 12 books, and is one of the most followed pediatrician in our country. But what sets him apart is not the numbers. It's his belief that the most important visit to the doctor is the one where nothing seems wrong. Please welcome Dr. Venugopal Reddy, and let's discuss childhood obesity, a very, very important topic. Good afternoon, Dr. Reddy, and thank you so much for taking out time. This is Health Commune, and I'm Dr. Smita, and welcome on our podcast.
Good afternoon, Dr. Smita. It is nice interaction with you. Yeah, it is. Obesity is a very interesting topic. I'm also excited to speak.
Correct. And we really wanted to speak about childhood obesity. Now, when we look at childhood obesity, we know that adult obesity is there, and you have done more than 2 lakh consultations in pediatric population. Is childhood obesity is really a disease, or are we just giving medications to something which is called the bad parenting?
See, this is very important and sensitive question, Dr. Smita.
Yes.
Before proceeding the question itself, I just want to briefly tell about background of obesity. Yeah, in fact, from 1975, if you see almost 50 years over, it has increased fivefolds from the obesity. In fact, India has become second rank globally after China, considering nearly almost 5% per year it is increasing as such. When you see the question is childhood obesity actually a disease, definitely childhood obesity officially recognized as a chronic disease by global bodies like WHO and the American Academy of Pediatrics. But calling it is a disease or just bad parenting is oversimplifying. It is a complex disease actually, childhood obesity.
Yes.
It is a biopsychosocial condition. If you ask me, biology, if you see genetics, hormones, metabolism, it will transfer from the parents or whatever it is. Second one is social or psychosocial. It is a behavioral diet. What we are preparing at home, generally kids will see and they will follow that same.
True.
At the same time, physical activity also. If parents are very active, generally their kids also will be very active.
Yes.
And they will be doing all exercise, whatever it is. Again, important factor, especially in urbanization, environment, and food marketing, advertisements, and screen cultures. Nowadays, everybody watching, including kids, reels. So, whatever it is, screen time, it is making more sedentary lifestyle. They are not spending much time outside. And at the same time, because of whatever income and socio-economic factors, now everybody can afford very good food or whatever it is. They want to give best to their kids, whatever they are asking. In olden days, it was not like that. If you see, all these factors are very important, not just blaming parent or somebody.
Exactly.
Yeah, it is a family lifestyle plays a very important role. As I discussed, apart from society or community, what it can do. Obesity is not a blame game actually. If you see, it is a systemic failure where involving family, society, and healthcare. In fact, as a doctors, we also has to see so much things. Just blaming either parents or school or whatever individual childhood, it is not correct. If a child is surrounded by lot of whatever it is junk food and advertisements, social media or marketing, and there is no space for the lack of space for the play or whatever it is, all these factors will play a very important role.
Very true. And if we look at in adult, these are the causative factors, similar for even adult. There we considered it as a disease. And I like it when you said that it's a disease. Let's not call it as a bad parenting, because when we considered it as a disease, there is some cure, there is some treatment that can happen. If we just call it bad parenting, then it goes into blame game. Wonderful. Now, I see when it comes to treatment, and I'm jumping directly into the treatment without talking about what are the symptoms, what are the signs. I think internet full of that information. But your valuable time I need for something very important is we see that now GLP-1 Ozempic kind of a products are also approved for, prescribed for children as young as 12 years old. Now, what do you think? Like, is it a good modality, or is it just a shortcut that we are looking at?
It is very interesting question, Dr. Smita. This is one of the most debatable topic. It is going on. If you see, I'm more into research. What is going on? It is one of the most debatable topic globally about the whatever GLP-1 unlocks. Especially, it has so many types of medicines. Full form of GLP is a glucagon-like peptide. Definitely, it is a glucagon-like peptide is a natural hormone produced in the gut. After when you eat, it will produce and it will control four functions. Especially before understanding about that drug, I just want to tell this thing. It will increase the insulin secretion, where to reduce the glucagon, and same time it will reduce the gastric emptying time, and it will act on brain. It will reduce appetite, this drug, and it will control the satiety signal from the brain. Exact component it has is a semi-glutatide. It has so many trade names: Ozempic, Vegago, liraglutide, and tisaglutide. So many drugs is there. When you talk about GLP-1, these are all the drugs is available in the market. And this is the way that it will work because of these mechanisms. Definitely, these drugs are just, it is a temporary, it will control the appetite regulation and pathway, and moreover, it will reduce the appetite, and at the same time, it will reduce the calories. But we here, everybody should understand is it is not trying to treat the root cause. We have to see the root cause, what exactly it is. And this drugs has a special indications where children has, or doctor has tried multiple ways to reduce the weight of the kid, especially when they are severe obese kids, and they will have something because of severe obesity. If they are not able to walk, joint pains, or some comorbid conditions like high cholesterol or heart conditions, then definitely we can think of adding this drug. But it has potential concerns like long-term safety in children. Still, it is not established. It requires so much data. In adult, yeah, they are using, but at the same time, in children, it requires so much data to do that. And other thing is dependency on medication. It will be there, and it will have psychological impact on children. Oh, if I have to lose the weight, I should take the drug. They won't see that they have to do exercise or whatever it is. All these things are the factors before considering. Yeah, definitely, whoever is treating doctor can think when to use. As I told, particularly it is useful only when we are not able to control traditional methods, and trying all methods. If it is not working out, they can try this. But still, so much data is required to about safety concern to see.
Now, usually, if the obesity is there in India, probably it's not been taken as a concern, and probably for that, parents may not take the child to a doctor. So, are the patients or children with obesity, are they coming to you directly? By themselves, like walk-in, or doctors are referring to you for super specialization care?
It is again definitely because as a pediatrician, many times they will be going outside or they will be knowing themselves. But here we have to consider about three things. When they are seeing, many times probably society or many people will think chubby child is a healthy child.
Yes.
Many times that it will give a false impression for the parents or whoever it is, grandparents. They may not come into this one. And when we are doing a regular consultation for anything, they may not come for just for the weight. They may come for regular checkup, vaccination, or whatever it is. Those times we have to see. Many times as a healthcare professionals, when we are busy, we might also not concentrate on entire thing as a consultation. Probably if they have come for something, we'll treat a fever or whatever it is, we'll leave it. That is, I can't say it is a mistake or whatever it is. This may sound uncomfortable if I'll tell. Ignoring early warning signs is very important. And ideally, when they will come for kids, we should plot their weight and height and see the growth chart. It will give clear picture than just seeing, okay, he's fine for whatever it is. Many times, if it is busy practitioners, if they are seeing 50, 100 patients per day, they may not have much time to see all these things. And definitely, there is a high chance they may miss this one, that whatever. And many times, when they'll come for whatever referral cases, generic advice will give. Oh, okay, do good exercise because of lack of time. Do good exercise, eat less, stop junk foods, just like that, and we'll tell and we'll
Yeah.
leave it. We are not stressing out what exactly they have to do, how many calories they are taking. We have to count those all these things, and because of this, what will happen? Parents also may not take seriously, and intervention it will get delayed, and we may not be looking at the complications. What all exactly is facing, we may not evaluate towards that.
True.
All these things will be there to whatever to do good for the kid or society about the obesity. We have to do early identification. We have to do
Correct.
Family based counseling we have to do. Not only kid or whatever it is, whoever is feeding kid, many times grandparents will be feeding. We have to tell everybody about that. And the structured follow up, if it is there, I think we should be able to address all these points.
Correct, correct. And as you said that, like if the kid is chubby and healthy, everybody likes it, like so cute, so nice. What's wrong? Like if the childhood obesity is there, what can go wrong? What are the problems or danger that we can see it in future that we are not able to see it today if the child is like just chubby and cute?
See, if this child is obese, definitely, and there is a term called metabolic syndrome, where metabolic syndrome will call it as when they have multiple systems involved, especially when obesity, child is more than overweight. We'll see that as per the WHO, we'll see, we'll plot their weight for height, weight for age. We'll plot if it is more than two standard deviation, we'll call it as obesity. See, one is if its weight is more, definitely joints, all these things it will be affected. Joint bearing areas, so they'll have more pain or something. And at the same time, they will have early development of diabetes type 2, insulin resistance. As I told, that whatever GLP, how it is like, insulin resistance they will get. Because of insulin resistance, they may get diabetes early. And similarly, cardiovascular diseases, heart-related complications, they may get more. In fact, blood pressure also it is one of the risky factor for them. If you ignore all these things, if parents, if they are thinking that child is chubby and healthy, these are all the, I think, silent killers. Nobody noticing many times because, as I said, we'll be ignoring when they are coming for the follow-up. If you are not concentrating on things, these things will be missed.
Got it.
And this is difficult part, but necessary conversation we should do with parents. As a pediatrician, we should encourage them to give good information, whatever best available information based on the best research.
Got it. And have you seen children getting diagnosed with type 2 diabetes, hypertension because of obesity?
Yeah, definitely. I saw diabetic cases more. Hypertension cases still it is less.
Okay. And what's the youngest?
See, I've seen 3 years child also.
Okay. Type 2.
Yes. Yeah, type 2 diabetes.
Okay. Okay.
That is one of the rare case, whatever I could see. In fact, sometimes family history also will be there. As I
Okay.
told, family history also, their family, I think early onset diabetes is there, and family itself has, I think, genetic factors. Probably everyone was a little chubby. That child also had. They
Okay.
were always trying to ignore that. Yeah, in our family, everybody is like that. That's why they will mask symptoms.
Okay. So I think if the parents they can see their child is slightly overweight, according to them is little overweight than children of their age, I think there are enough tools that are available online that they can go and check whether the weight is going into the obesity mode, and they should visit a pediatrician at least once to see if any early onset of diseases are already there or not. I think that's a good recommendation. And other thing that you said is when a child is visiting pediatrician for immunization, that time a doctor can see where the weight is going and what could be the root cause. I think that's a good takeaway message. How parents should be managing this, right? Like we talked about it, that whatever the choices parents are making is the choice child will make. Now, who's responsible for drawing this line? Like, is it parents who have to, get into more disciplined, healthy lifestyle, or is it a child who's not supposed to do what parents are doing? Like, where exactly we are looking at how the family should be operating?
The entire goal is it is support. It is not blame of anybody. Yeah, as a child, probably I think he might be not knowing if the child is 5 years or whatever it is. Till they come to know, especially they may realize if they are overweight or whatever it is. At least an average. Based on Indian conscience, it may require 8 to 10 years to think for themselves they are overweight. By the time I think that window period will go. Here, other things is definitely family is very important. Family in the sense parents, grandparents, whoever it is there in, they should have healthy lifestyle. Family, kids will see us and they will copy it. If you have good whatever habits of food habits, they will copy it from the parent.
True.
And good physical activity if is there, they will copy it. And yeah, at the same time, yeah, as screen time, whatever it is, we should cut screen time. We should encourage them to go and play outside. To do that again, that space constraint will be there because of urbanization, whatever, many apartments, they are not giving space for the kids to play. whatever it is, cycling, those community also one of the important factor for this. At the same time, pediatricians, when they'll come, they should ideally proper counseling they should do, family counseling. Counseling also with we should document. If it is not done, these things happens. Not just telling, as I told earlier, many times if you are busy, they will tell they have to do good exercise. They should not eat the junk food. In 2 lines, they will finish it up. We have to plot their weight and height in growth chart. We have to show them what exactly is happening. If this is continue, what is expected for next couple of months or next year, and what are all the side effects it will happen. See, it is a parents, family members, society, doctors, everybody is responsible. Child is last responsible for the things. Yeah.
Child is a child. I have very quick rapid fire questions for you. What's the biggest myth parent believe about their child's weight?
Yeah, as I said, a chubby child, they always think a healthy child.
Healthy child, yes.
Yeah, chubbiness, it will hide so much metabolic risk.
Screen time or sugar? Which is the worst villain?
Screen time, definitely, because it drives in different ways. One is social activity, it will stop it. Physical activity will stop it, and ultimately it will reduce even mind also activity. It will reduce. Yeah, it will cause multiple problems. Screen is more dangerous than sugar, no doubt.
One food you wish would disappear from the school cafeterias?
It is sugary drinks, especially packaged juices and whatever they will keep, sodas or whatever it is. Sugary drinks, so we should avoid it because it will have high sugar and zero satiety will be there, and so many calories will be there, hidden calories will be there.
Age you should start having a weight conversation with a child?
See, it is not about weight, Dr. Smita. It is about health. As early as is, we should be able to counsel or concentrate from 5 to 6 years of age. And we should not do no body shaming, and we should focus on their strength, energy, and health.
One thing every parent should do tomorrow morning, no excuse.
Actually, having breakfast together without screens, it will give so much benefit for the parents also, for the kids also, because it will build habits and they will be copying parents, as I told. Food quality it will improve, and bonding again, it will improve the bonding.
Very true. But I don't know how easy it will be because usually my daughter goes to school as soon as she'll wake up, and we get
Yeah.
breakfast time together only over weekend. But I agree. I think spending time on dining, we call our dining a meeting room.
So yeah, nowadays in schools, yeah, they will start as early as 6 o'clock. They will be going. I think
Yes,
everybody will have breakfast at schools. If it is that is missing, I think we can plan something, dinner or something together.
lunch at least
It
together.
will help.
Yes, one meal time is definitely important. I was looking at your LinkedIn and I saw a couple of things that you are speaking about, especially AI and pediatrics. Whether it is a technology, there are many tools that are coming up which probably claiming that they will be able to help children with obesity and probably will be able to support parents. All these things are while it is going on. And I think it's also related to some CME talk that you were participating into. So, what's your take on AI that is trying to help parents for better parenting, especially in terms of childhood obesity?
AI can help. Again, here it is one of the major factors when we have discussed, Dr. Smita. Three factors, 3 or 4 factors, whichever I told. One is genetic factors.
Yes.
Yeah, genetic factors anyway, I think we won't be able to modify if it is something it is there as per the related to the obesity. And social factors and economic factors also it is there. Those are all modifiable factors that they should be able to modify. Especially when it comes to diet, AI can help because I am doing in PhD in AI actually.
Oh, okay.
Yeah, it is my 5th year. I'm going to complete my PhD in probably this month.
Oh my God. Okay.
I made so much. Yeah. See, here AI is helping many people, especially diet. It is a person or religion specific guidelines it can give, especially when it concerns to diet. Suppose in India, it is a multi diversity, whatever it is, vegetarian, non vegetarian, South Indian, North Indian, whatever it is, Andhra, Tamil, whatever it is, Karnataka, based on whatever preference you are having. If you see that, if you enter, select those things which you are able to control. Example, in non-vegetarian, whatever it is, I like it. I want to control my child weight eating this one. If you enter the data of your whatever this one you want your child age and weight, what is desired target, It is going to give a structured framework for the diet. That is one of the very important thing, especially when it comes to obesity. And other factors is there where it can track about their activity, calories, or how much they can spend, what they are eating. If they are entering, it will give again.
Yes, I agree. I don't know. I have not seen any startup who's specifically working on this.
No, it will come because I told you, right? It is in research phase. It
Okay,
should
okay.
come it. Probably, I think in next year they should be able to come out.
True, true. That'll be wonderful. That I think that'll help. And that was Dr. Venugopal Reddy speaking about childhood obesity. Wasn't that insightful? If you want more such information, make sure you follow us. This is Health Commune. You're listening to Dr. Smita. Real doctors, real answers.